Hilary and myself have been working in Ethiopia on this project for a number of years now, also thanks to the direct involvement of KOPIN. Hilary and I will be doing this interactively, so some slides and concepts will be introduced and discussed directly by Hilary. So it will be really done by both of us. So I would like to take you through this project, which had many facets. Therefore, we're going to discuss with you today just one part of it, which looks at climate change impacts in the field of food security and how an intervention, like the one that we'll be discussing together, therefore the building of a biogas system, has interacted or impacted food security in this very small community in Ethiopia. So the objectives of the project were much bigger, were those of assessing the impact of the intervention on many aspects of the livelihoods of the community. Today we're just going to focus on food security. So let me take you through, please, on the next slide, on some of the literature that we know. So what do we know about the importance of urban agriculture within small urban communities and the impact that this can have on their food security? So basically we know that they can have a positive effect, positive impact on food security, and at times the role of urban gardens has been very important to sustain livelihoods in the face of shocks, like in the case of prolonged droughts. So at times they've been very important. We know that there is an history, particularly in Ethiopia, of relying on this, the false banana tree, which is usually kept in the houses outside, in the vicinity of the houses of people. In case of droughts, they've been very important to ensure a minimum amount of food being taken. We also know that urban gardens are being promoted in many developing countries, often in conjunction with biogas systems through the use of the biogas slurry. We'll be taking you through the intervention later on to give you a better idea of how the biogas system works, but basically there is a byproduct, which is the slurry, which is the fertilizer in these urban gardens. However, although we know that these systems work well and have had positive effects, we don't know yet, there are many gaps on how these biogas systems interact with sanitation programs to improve food security in formal urban areas. There are very few studies that assess this quantitatively and that can establish a para-causal relationship. That's where our study, we believe, comes in favorably to trying to establish this relationship. Therefore, do urban gardens helped by biogas help assist to find better food security? There is another problem which Hilary is an expert on, and will go through it probably better than I can do, that most of this data which is available is often looking at large areas, and it doesn't zoom in the small communities. So there is a gap also in assessing how the small communities are facing these shocks. Now, the biogas intervention that we have worked on and that KOPIN has helped to implement on the ground works on two levels. It provides latrines and it provides also biogas, which is produced by also the way animal and human waste. Now, we know that from the literature this can have very good public health benefits. They can reduce the level of indoors air pollution by not making extensive use of firewood, which can cause a lot of health problems, as well as impacting deforestation and increasing greenhouse gas emissions. So overall, we know that these programs, the biogas and sanitation programs, are very helpful. However, there is another component which is less studied, which is the impact of training. So to what extent training added to these interventions can help and provide further benefits to the community. So in our studies, we try to do exactly this, to assess the impact of training and the impact of the biogas intervention and the interaction between these two to see to what extent this would help to increase food security. Now, you might ask yourself, what is the policy relevance of this? So what do we want to know about this? Now, actually, currently, there are many countries, including Ethiopia, that are adopting these national plans to implement biogas facilities throughout the country. There are many projects that interact at the community level to build biogases. These are financed mostly by overseas development assistance and by international funds. However, with the gaps that I've just highlighted with you, we don't really know the full extent of the effects, the impacts that these biogas systems can have on food security. So there is scope for research such as those that we are trying to dig through and to also publish to understand a bit better whether these interventions are cost effective, they achieve the objective of increasing food security, and while addressing also problems in relation to climate change impacts. To this aim, I'm going to leave the floor to Hilary, who will take you through the next slides and also phases of our study. Hilary, back to you.
Okay, thank you, Stefano. Can you all hear me over there?
Yes.
I hope. Yeah, great. I know my accent might sound a little odd, so if you can't understand me, please start waving your arms around and I can see that, and I'll slow down a little bit. Okay. All right, so a little bit about the context. So I'll start off by telling you about where we actually conducted the study and what we did. So we looked at community-level vulnerability in two informal urban settlements in Shashamene, and that map there shows you where this is located. So in Ethiopia, we have Addis Ababa is pretty much in the middle. Shashamene is about 250 kilometres by road to the south. And that takes about 6 hours by car, just to give you a little bit of a context. So in that figure, we've got the two communities marked out there in the map, very imaginatively called Community A and Community B. And they're located very close to each other. They're only about 1 kilometre apart. So we're looking at climate variability and health vulnerability, and we also, Stefano's talking about an intervention that was implemented there. So that had lots and lots of potential outcomes, but the focus today is on food security. Okay. So here just to set the scene a little bit more, so the Community A, you can see in the top right, it's just an outline of the community. It's bordered by rivers and roads. And just below that is a picture of what the community looks like from one of those roads during the dry season. So you can see it's fairly dry down there. The little green patch running along the bottom is along the river. And to the left of that, you can see the photo's taken from pretty much just underneath where the other photo is. And you can see that there are children playing there, and that's actually the river where they're getting lots of their water from. Now, Stefano, did you want to have a quick word about the other photos on that slide?
You can see, yes, thank you, Hilary. There is an extensive use of firewood and charcoal, which is the top photo with the woman selling charcoal and firewood at in the local markets. So our idea was also to understand the level of use in terms of kilograms weekly and monthly of this charcoal, and we did find out that that's the main source of the energy supply, basically, how also they cook their food. The photo underneath with the red cross is a previous intervention on sanitation that built latrines, and as you can see, wasn't really successful. So we try to understand also the existence of other interventions, other projects in the area, to have a bit of a background on what could look like our intervention and the extent to which this could be helpful in the area. Of course, that intervention, as you can see, wasn't successful, so there was a little bit of mistrust in the at the beginning of the project on the potential outcomes. But as you can see, and you will hear throughout the presentation, our outcomes are much different. So Hilary, back to you.
Okay, so this just shows some of the key demographic characteristics of the two communities, and just a few things to point out here. You can see that the communities are young. So the mean ages are fairly young, 23 years in one, 18 years in the other. You can see that community B is slightly more crowded in terms of number of people per household. They have higher household incomes, but if you break that down by income per person, it's a little bit less. You can see some differences in the education levels achieved by people in the two communities. So in Community A, nearly everybody has been to at least preschool. In Community B, it's less than half. So some key differences there in education. In the ethnic mix in the two communities, they're quite different as well. So in Community B, there's one dominant ethnic group, and it's much more mixed in Community A. Religion-wise, again, a slightly different picture between the two communities. So Christian Orthodox makes up more than half in Community A, whereas nearly 3/4 in Community B are Christian Protestant. So just some sort of differences to show that even though these two communities are very close to each other and have lots of similarities, there are also some key differences that might be affecting their overall vulnerability and the way that they do things as well. So a little bit of information about the sorts of ways that these communities are particularly vulnerable in terms of public health. Both communities relied on external vendors for water, so they didn't have an internal water source within the community other than the river, which is, as you saw in the previous photo, there wasn't much flow, it wasn't very clean, and certainly water shortage is a problem. Malaria and typhoid do occur in these communities, and once again, differences between the two communities. So more common in Community A. Seasonal differences are important in terms of health as well, and that gives us some ideas as to how these communities might be particularly vulnerable to climate variability and change. Both communities found that floods were a risk, so even though you could see in that photo that everything looked very dry, the climate in this part of Ethiopia is very much wet season, dry season, and so you can have the same place that is subject to both droughts and to floods at different times of the year. So water shortages are fairly common, and this affects people's ability to wash, so it affects sort of disease transmission as well. People did say that they felt that temperatures were increasing, and it was actually making physical labour more difficult. So people working in the gardens, for example, it makes, when temperatures increase outside, it actually makes physical labour more difficult. So this is just to give you a sense of what's actually happening to climate and in this particular area. So you can see that across the 3 different seasons, we're looking at the top, we've got what's called the little rains. It's a sort of a very micro wet season, if you like, that occurs in April. There's the main wet season that occurs July to September, and then down the bottom there's the driest months, which is November to January. And as you can see, temperature, the black line on all those graphs is observed temperature. So you can see a little bit of a trend that's been occurring there for increasing temperature, both for nighttime minimum temperatures on the left-hand column and daytime maximum temperatures on the right. And the multiple coloured fuzzy lines are as modelled temperature. according to different scenarios. So you can see there's a general upward trend there as well. So basically temperatures are getting warmer. That's happening across all seasons, and it's happening at the nighttime minimums as well as the daytime maximums. So just a little bit about the intervention, and Stefano, of course, feel free to jump in. It was a community biogas project, and the purpose of this, or the facilities that were provided, were a community latrine, so four separate latrines. And then these were connected, the waste from these latrines is collected, and it ferments and produces methane, and then this methane is then pumped into a nearby community kitchen. So you can see on the right-hand side there, that's the kitchen burners, using the gas from the biogas. And other parts of the facility included a couple of fuel-saving wood stoves, and that's what you can see on the left-hand side. The woman there is making injera, which is the local staple bread, if you like. So that's part of the facility as well. And also part of the facility that you can't see there is piped water as well. And Stefano might want to mention a little bit more about that.
Thank you, Hilary. We provided water coming from the aqueduct, the municipality aqueduct, so the water is supposedly clean and controlled, much more than the one coming from the river. So this was also the infrastructure that was provided through the project. As you can see at the bottom, there are two people standing up on a slab of cement. There is where they collect the bioslurry, which is the slurry left after the process of fermentation, which gives the methane. Now, people from the community can access that bioslurry and use it for an urban garden they have nearby the latrine. So you can see there is a patch at the back of the latrines where people in the community use the bioslurry as a biofertilizer for their crops. Now, we have witnesses in the course of these 4 years that have been visiting the use of biofertilizers in that patch many times. However, we have to register, this is just to close also on the observed and projected climate change impacts, that in the last period, because of the current droughts that Ethiopia is experiencing, so a massive lack of water has impacted also our urban garden. They were instructed not to plant anything because of lack of rain. Therefore, for this specific season, they are not using that patch because the government, the local authorities told them not to use or not to plant anything because there wouldn't be enough water, rainwater we're talking about, of course, to keep up with the production, sustainable production of any type of crop. So, unfortunately, this is also the result of this current climate variability. On the basis of this, we set up this field experiment trying to assess the impact of this intervention of the biogas and the training provided with the intervention on food security. How did we do that? So we had a mixed methodology approach. We apply both qualitative and quantitative methods. In the first part, we try to assess the development status of the community with focus groups, trying to understand also what type of shocks they experience. Therefore, we found out from these interviews that higher temperature and droughts have already been affecting the community for a long time. We use a specific tool called Crystal, which tries to investigate the vulnerability climate change adaptation at the local level, which was very interesting. The focus groups were conducted separately, both for women and men, so as to give freedom of better ways of expressing their views among women and men separately. And in the second step, we measured quantitatively the effect of the training and the biogas on food security with collecting surveys before and after the intervention. So the conceptual model here, the hypothesis, is that when we control for all other factors like age, education, current level of income, and other important factors, our initial hypothesis is that there is a positive influence both on public health as well as on food security by training per se. And when we have the interaction between the use of the facilities and training, these outcomes will be even more enhanced and positive. Right, so this is a picture of one of the results from the participatory focus groups that we conducted. So we used the maps, they're called visual maps, so as to give also to people who have problem with communication. There are some communication barriers to express their views through the use of graphical help, basically. So we had someone from the community helping us drawing this map, and they have identified all the important places that for them are key in their everyday life to sustain their livelihoods. So you can see there is the mosque, there is the church, there is the bridge that we saw before in the photo, the market, and in red you can see the shocks that affect those actions, those places that they experience and use every day. So as you can see, the drought affect the river in terms of the amount of water they receive, as well as in the rainy season, floods from the river affect the community in the opposite way. So through this, we could confirm, as well as find out, that these shocks, particularly droughts and warmer temperature, are affecting their livelihoods, also food security. In the second step, which was the quantitative assessment, we try to quantify and to establish a causal relationship between the intervention, training, and food security. So in the next slide, we'll show you how these effects are happening in the community, dividing it into two. So in the first part on top, you will find the effect on the whole community, on the 200 households who live in the community.
Stefano,
yes?
Sorry to interfere. We just have like a minute or so left. I know it's a little constraining.
Yeah, I'm on the way. I'm on the way to finish.
Okay,
Thank you. In the bottom part, you will see the effects of the intervention and training on food security for those who live close to the facility, so close to the latrines. So we can see that training has an effect on health and the use of the facilities, but for those people who live close, there is an interaction effect that also has positive effect on food security. Therefore, people who live close and receive training have increased their food security. They spend less periods without food to eat. They also experience more food, more income security, and there is an overall better positive effect of due to training and use of the facilities and the positive effect of food security. So of course, we need to acknowledge some ongoing caveats and issues in terms of the sample is relatively small for those living close by, and they would need of course, there is the need to have further studies on similar communities to extend and achieve external validity of the study. So studying one community only, it's never enough. But of course, that's what we could do in this instance, and we look forward to having similar projects. So what can we conclude out of this research and looking at food security? We see that the majority of the shocks are due to climate variability and change. Droughts, higher temperature, floods, as well as fluctuation of commodity prices are the main shocks, and they're all highly related to climate variability and change. We noticed that the interaction between the infrastructure and the training has had a positive effect on food security and on health outcomes. Therefore, there is an argument here to replicate such interventions in similar informal communities, because these are projects, interventions that appear to have a positive effect on food security and health outcomes. So these conclusions, this research can inform current implementation of the plans of the national Ethiopian authorities and those in the nearby area in the construction and use of biogas systems. So we're quite confident on that. I would like to finish on, if you're interested, there is part of this research has already been published in these journals. There is free access, and there is also a small short video that gives you an idea of the area which you can watch online. Thank you very much for your attention.
Thank you.